Hi everyone, good afternoon and welcome to my dissertation talk. My name is Mhairi Allardice and my dissertation is called Me, Myself and I. It's about social isolation and mental health during the Covid-19 pandemic.
We see examples of pandemics increasing people's risk of poor mental health throughout history. In Toronto's quarantine for SARS in 2003, 32% of individuals experienced depression, and those quarantined during the AIDS pandemic experienced levels of depression and anxiety at twice the rate of the general populace. Taylor 2019 identified that governing bodies often do not adequately prepare for the mental health effects of a pandemic. There are certain groups of people that are at higher risk of declining mental health, particularly those who experience isolating conditions as a consequence of lockdown restrictions. This includes people who live alone or working from home or those with pre-existing mental health conditions.
So the current study, we really wanted to assess mental health before, during and after the lockdown. Now, when we say the lockdown in this study, we mean the first UK lockdown. So this was the lockdown that happened in March of last year, so 2020. We wanted to look at mental health, but obviously mental health is a large field, so we decided to look at well-being and satisfaction, as well as collecting quantitative data from the well-being and satisfaction metrics. We also wanted to give our participants the chance to provide us with qualitative data, basically explaining their reasons for their scores on the well-being and satisfaction questionnaires. We thought this would be really valuable because obviously quantitative data is very useful in itself, but I feel like qualitative data really adds a lot of potential for reasoning as to why participants have said what they've said or why they felt what they felt. And it also gives you room to maybe hear about some positive experiences from the lockdown, because some of our participants did actually experience positive outcomes and positive mental health outcomes, which we thought was quite interesting. We also wanted to look at variances in demographics. So basically, demographics that research suggested would predispose somebody to feel more isolated. So things like living alone, being disabled, working from home, furloughed, things like that. You know, the typical things that have come from this COVID-19 pandemic lockdown. We really wanted to see how these demographics affected well-being and life satisfaction, and also in the long answer questions we wanted to see if these really came through, if living alone did create their feelings of isolation, or if disability possibly posed more challenges that affected mental health. So our hypotheses for this current research is that there will be a significant reduction in participants' well-being and life satisfaction scores from before first UK lockdown all the way to during the first UK lockdown. So we did actually look at before, during, and after. However, something about the after condition will be explained later in the discussion, as unfortunately, when we did take our after lockdown, most of our participants were experiencing a second lockdown. So I feel like that didn't give us an accurate reading of the longitudinal effects of being in a lockdown situation on mental health. Our second hypotheses were that we assumed these differences will be most prevalent among those in demographic categories that are predisposed to experiencing isolation. As I mentioned previously, those who live alone, were furloughed, or work from home, basically those things I mentioned there. So in terms of our methodology, our quantitative methods, we used the Warwick Edinburgh Mental Health Scale, or the WEBS, to measure well-being. It's a 5-point Likert scale, and we used it because previous studies show that it has high levels of internal consistency and reliability. In terms of measuring life satisfaction, we use a satisfaction with life scale, which is a 7-point Likert scale, quite similar to the Warwick, but with a little bit more room to likely, not sure. When assessing this data, we did correct for greenhouse gas. So this was basically just to check, as many of you will know, to make sure the assumptions of sphericity were met, and basically just to make sure that our data was as clean as possible. For the purposes of this presentation, we also produced threshold values of poor, medium, and high mental health, drawn on the basis of value classification that we found in Kaihat et al. 2007. This is basically just to show you tangibly in tables and a visual aid to show you how well-being and life satisfaction changed in the before, during, and after conditions throughout the study. For our qualitative methods, we gathered data from long answer questions. We allowed participants to give explanations as to differing well-being and satisfaction scores. It gave us insight into possible issues arisen through lockdown measures, and this was useful to us because we could identify reoccurring themes and trends, and we analysed these for possibly correlating issues, which obviously we'll speak about later. So as we can see in our quantitative results, the means for the mental well-being scale and satisfaction with life scale in the before, during, and after conditions did follow the trend of what we assumed in the hypothesis they would be. So they were higher during the before condition and they became lower in the during condition. However, our thresholds do categorize them as medium, so it's not a significant difference. However, with the standard error being small, the sample is likely to be representative of the general population. As you can see from the difference in means in the well-being scores, As you can see from the differences in the well-being mean scores, there was a statistically significant drop in well-being as people went into lockdown. This then rose again once lockdown lifted. However, well-being still remained significantly lower after lockdown than before, suggesting the pandemic regulations did have longitudinal effects. The same trend of a drop entering lockdown and a rise of afterward, so basically after coming out of the lockdown situation, can be seen in the measures of life satisfaction as well, both of which are significant at a 95% confidence level. Interestingly, there is no significant change in satisfaction with life before and after, suggesting detrimental impacts were not sustained long term. So basically what I mean there is with well-being, the means didn't return to their normal levels. So they didn't return in the after condition, they didn't return to their before level. They still remained slightly lower in the after condition than in the before. However, with satisfaction with life, the after condition returned them to very similar levels to the before condition, suggesting that there was definitely a difference in the lockdown's effect, or the situation in the lockdown effect, on satisfaction with life when comparing it to well-being. As you can see on this slide, we have visualised the scores of well-being through those previously mentioned thresholds and looked at the directional change before, during, and after lockdown. As you can see in this first graph, a small subsection of the sample's well-being improved post-lockdown. However, the majority of the respondents experienced no change between the thresholds or felt worse after lockdown ended. Once you remove those already predisposed to having poor mental health from our demographic, you can see in the second graph a much larger percentage of the respondents experienced a drop in their feelings of well-being between the lockdown period and after measures were relaxed, suggesting there were long-term impacts to people's mental well-being. In this graph here, we look at satisfaction with life categorised by thresholds as well. These two groups show us the entire sample of respondents and the sample of those not already predisposed to poor mental health. Here we see a more strong visualization of our original hypothesis that satisfaction with life would reduce entering lockdown and rise again once restrictions lifted. The effect on satisfaction showing more strongly in our subsection demographic. You can see in the third column of both graphs that the majority of respondents reported that the levels of satisfaction with life returned to normal levels after lockdown, a difference in mean score of only 1.1. This is interesting to note, this difference compared to well-being, which appeared to show more long-term impacts. To further analyse the effect of risk factors on well-being and life satisfaction, we conducted a univariate analysis of multiple risk factors and their relationship to all three conditions in both scales. The most notable of these univariate analyses conducted was that those with existing mental health conditions, so basically those who ticked yes on do you have a pre-existing mental health condition in the demographic questions, experienced greater reductions in their well-being scores. This was mostly notable because these reductions were sustained after the lift of the lockdown regulations. However, this could have also been due to the fact that when we did take the after lockdown wellbeing scores, there was unfortunately a second lockdown, so many of our participants did conduct it during the second lockdown, so we didn't really get a true reading, but this was still notable. Also, those living alone, which was a significant risk factor, as previously mentioned in past research, experienced greater reductions in their satisfaction with life scores. In terms of the themes identified in our qualitative data analysis, we found that there was an increase in anxiety and stress feelings, making some participants' mental health issues, quote unquote, worse. Loneliness was another main theme, with participants finding the lockdown an extremely isolating experience. This isolation also increased their experience of depressive feelings. So, as was hoped, the qualitative data really kind of gave us insight as to the emotions backing their scores for life satisfaction and well-being, because obviously the quantitative data did show that there was a decrease for during lockdown, but the qualitative data really kind of gave us insight as to what was going on for these participants, what different aspects of the lockdown was affecting them and in what way it was affecting them. What's most notable here is that feeling of loneliness and how it correlated with people with pre-existing mental health issues. So this definitely fits with previous research and how people experiencing the risk factors that we spoke about earlier, how the idea of loneliness was really prevalent for them because their risk factors predispose them to being more isolated during the lockdown situation. Well-being and life satisfaction significantly decreased as a consequence of lockdown. This was expected due to previous research, hence why the hypotheses were there in the beginning. As mentioned, the isolating effects of lockdown can be detrimental to an individual's mental health. As was noted in the results, risk factors from isolation, such as disability and a previous history of mental health, increase the likelihood of reduction in both well-being and life satisfaction. When comparing life satisfaction and well-being, life satisfaction was actually greatly affected. We can assume this is because of the restrictions placed upon people in lockdown. For example, well-being focuses more on mood as compared to life satisfaction, which focuses more on general life goals. So someone may feel content in their day-to-day life during lockdown and so score highly on the well-being scale. However, when faced with, say, a broader satisfaction scale question, such as is their life ideal, or was their life ideal at the time when they filled it out, this is more likely to have been affected by lockdown, basically because of the restrictions placed on freedom. And these would have been like a key part to people's kind of ideal of life, you know, having that dedicated social time and that time to leave the house and change environment. However, due to the restrictions placed, this time was taken away from people. So a lot of people were working from home, so still had kind of the work requirement, but didn't get that essential downtime that would have helped them sustain or manage their mental health previously. So I think this is probably one of the greatest differences between the differences we saw in well-being and life satisfaction. So in kind of concluding what we've gone through so far, I feel like this research really offers a valuable insight into lockdown effects on mental health, particularly those who are at risk of isolation. I would say that further study into what factors influence positive directional change is also quite valuable because in our qualitative data, we did actually get some answers that indicated that lockdown was actually beneficial to people. So it gave them more time to, with hobbies, gave them more time to find hobbies, experience different things like learn languages and things like that. So a lot of people actually found it a very valuable experience, and we had some reports of it helping them manage their time better, because since they were working from home, obviously commuting to and from work or to and from lectures, things like that, they found they had more time to actually do what they wanted. So I think studying the benefits of lockdown might actually help form better mental health management for the future. So kind of have a idea of how people can make the best for their mental health if this ever happens again, or if we go into what is it now, a fourth lockdown. I think the study also offers insight into the consequences of subsequent lockdowns. So what I kind of mean by this is, obviously we looked at the first lockdown, but as I've mentioned throughout, the after condition kind of bled into the second UK lockdown, and occasionally I think it bled into the third as well. So that probably explains why, especially with wellbeing, the scores didn't return completely to normal. They still stayed quite low. So it does really kind of give that framework to work from, to show that subsequent lockdowns do clearly need more research. And it also further demonstrates the need for mental health preparations for pandemics. As explained in Taylor 2019, there was really a lack of mental health preparation, and unfortunately this has had quite a significant knock on a lot of people's mental health. And hopefully in the future there will be things in place that will help people recover, because I think from what I've read of all the qualitative data responses and from some of the scores I've seen, this has had a very detrimental effect, and it appears that this effect could have quite a longitudinal stay. So hopefully this research helps in kind of identifying the issues that need to be addressed. Well, thank you for listening to the talk. I hope it was informative and got everybody thinking, and I hope you enjoy the rest of our talks today. Thank you ever so much.